points that she's exaggerating?
She says, when I cry, I show by crying noisily, and I want consolation.
Yes. She doesn't cry, she sobs. She cries noisily. Anything else? Let me see. I am nervous or angry or weep all the time. At times great anger, at times calm. We have a person that goes to the extremes. When angry, I break things. Not many women break things when they are angry. It's an exaggeration of a behavior. The way she speaks about her fears, and especially about her pain, there is an exaggeration. Maybe this is the case, this is the reality. She is very much affected by pains. Who can tell me the rubric that we can start thinking when we see how she talks about her fears and her pain? Hysteria. She's hysterical. Why? She says herself, the doctor says that she came to her, she was married. There was no dyspareunia, no pain during the sex before the marriage. After the marriage, she started having dyspareunia. She says that I love my husband. He is my support. He is very compassionate, very, 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 very. But she gets married and she starts having pain during the sex. Not only this, she visits the doctor a little bit after, some days after she got married. And what does she have? She has this kind of pain at the thigh that she says, I can't walk. And then she reveals that the doctor examines her and she finds nothing pathological. But nothing can justify that this person cannot walk. And then she says to her that getting married cost her a lot of anxiety. The doctor should have asked, why? There is no why here. It's a very important information. Why? And she also says, the patient says, perhaps she has been doing analysis or therapy because she uses the term, the psychological or medical term, somatization. She says that at the first page, events, yes. I had another hysterical thing. I can't bring to my mind the picture of my father, whom I loved very much, that died. I don't remember the funeral. I don't remember anything. Why don't I remember it? Because I have such a great numbness in my head. And I can't remember. This is a hysterical thing. She also says, I've come to a somatization and I had back pains. Okay?
additionally, she accepts that she is a hysterical type of character because she tells, I am incredibly phobic and this intensifies my physical symptoms.
Yes, her fears intensify her pains. She is so much sensitive to pain. Hysterical people have this characteristic. So we have to do with a hysterical person. And to what miasm does this lead us? To the syphilitic miasm. Do we have inconsistencies also? Please, there is a great inconsistency that you must have already noticed. Please, someone.
She loves her husband. She wants not to lose. She doesn't want to lose him, but she doesn't want to marry him.
She doesn't even enjoy sex with him. She has pain. So, from the one side, we have he is affectionate, understanding. There's companionship from his side. I am the one who suppresses myself. John tries to work as a safety valve for me. Exaggeration. I have, okay, and then she said, supports. She says, I can't imagine my life without him. It's like seeing a Hollywood movie. I can't imagine my life without him. A soap opera. He is my support. And on the other side, what do we see? They got married. She had a hard time getting married, she says herself. She started having hysterical pains. She started having pain during sex. She doesn't want to have a baby. She doesn't tell him that she doesn't want to have a baby because she's afraid of losing him. So, what do we have here? Apart from inconsistencies, we have skopimότητα, we have intention. We have intention. We have deliberate action. Because we have an egoistic person. If I am honest, I would say to my husband, okay, we were okay before getting married. Now that we got married, I don't feel well. I don't want to have sex with you. I don't want to have a baby with you. I don't love you. But she doesn't say so. And she reveals to the doctor, I don't want to lose him. Why? Because he is my support. He is my safety valve. So this is egoistic. I love him because he does this to me, that to me, and that to me. And I don't tell him that I don't love him anymore. I'm not honest. I pretend to love him. I even pretend to the doctor that he's this to me and that to me, and he's so compassionate, so that, so this. But it's all ego. It's all my benefit. It's all something that serves my interests. It works for me, and I don't care if it works for him. If I am sorry and I have pain during the sexual intercourse, I feel guilty about my companion. I worry. I say, I don't enjoy sex and he doesn't enjoy sex. I feel bad about it. And I am honest, I would say, I don't want to have a baby. She says, I don't want to have a baby because I can't cope with it physically and psychologically. But then, if you are not happy, you say to yourself, I'm not happy and I have to get a divorce. You say to your companion, I am not happy, where our relation is not a working one. So should we get a divorce? But because she has these benefits from this marriage, she doesn't want to have a divorce. She doesn't even want to tell to her husband that she is not well. But any kind of doctor or any person that could see this case says that they are not well. She is not well, their marriage is not well. It's not okay. So there is a great possibility that this person is syphilitic and hysteric. This is so helpful to our diagnosis with the classical miasmatic constitutional homeopathy. You see, we haven't seen any rubric. We haven't checked the repertory to find any rubrics. We just analyzed the patient. We've talked about him. But we've examined her in a certain miasmatic and constitutional way. Like true detectives. Like people that have learned to observe, to think objectively. So, she is not psoric, definitely. Someone that focuses on rubrics, could say, psoric rubric. She is fond of her husband, and she praises her husband, that he is good, that he is supporting, that he is this. Someone else could say psoric because she is afraid of diseases, she's afraid of this, she's afraid of that, she's afraid of losing her husband, she is afraid anything. But this is not the case. This is all secondary behavior. It's not primary behavior. If we believe what the patient says, especially if the patient pretends, if the patient is a syphilitic person, we are lost. We are definitely lost. In Bruges, a town near the sea in Belgium, a couple of months ago, there was organized a certain, let's say, congress. It was organized by the two most selling companies that sell computer expert systems in homeopathy. They have invited 10 or 11 of, I don't remember, 10 or 11 experts, masters of homeopathy that have their own homeopathic school, and they, most of them use this kind of computer expert systems. And the theme of the Congress was to have a presentation of a case, and then these 11 experts would prescribe according to their own method, according to a certain computer expert system, or according to their method. I want to ask you, How many different prescriptions do you think that there was at the Congress? 11 experts. I want guessings. 1? Did they all agree? 3, 5, 7, 9, or 11? 11. What is the conclusion? That if a method, perhaps there was a prescription that was correct, but why do we have 11 different opinions from experts in homeopathy that have practiced homeopathy and learned homeopathy and have taught homeopathy so many years, decades? Because if you don't apply the universal laws in prescribing, then you have 11 or 111 prescriptions, different prescriptions. So, that doesn't mean that if they have prescribed the remedies they thought that were the similium, that they wouldn't have any kind of result. Why? Because if you have full similarity, you have the deepest and more permanent results. But if you are close, even if you don't have full similarity, you are going to have some results. So that doesn't mean that there is only one correct homeopathy and all the other are rubbish. No. But you can get closer to deeper results if you apply the homeopathic and universal laws. So, psychotic. Is the patient psychotic? As to ideals, as to the way she lives her life? No. If she was psychotic, she wouldn't have hysterical symptoms. I want to have sex, I will have sex. I don't want to have sex, get off my back. She is psychotic to expression. She has a very intense expression of her pains, of her fears, of her anger, and so on. But this is something that has to do more with her hysterical and syphilitic identity. So we have a person that is clearly syphilitic and at a great extent, hysterical. What do you start thinking? What kind of constitutional pictures comes to your mind? Be careful. We have talked about the hysterical constitutional pictures, but what we have talked about were the main hysterical constitutional pictures. We may have syphilitic individuals that are not as a whole hysterical, but may have some hysterical symptoms. Okay? Lachesis is not hysterical, but she may have some seemingly hysterical symptoms. Ignacia also, although she is psoric. Sepia, and so on. So, we start thinking of syphilitic constitutional pictures and at some point hysterical also. What do you think of? What do you propose? Valeriana. Anything else? Platinum. Lachesis. Someone said platinum or not? Anything else? Moschus. Palladium. Yes? Anything else? Cyclamen. Stramonium, she breaks things, she's got a lot of anger, she wants things to be done her own way and so on. So let's think of Stramonium also. Now it's the time to go on the opposite way. We have seen the general picture, we have made some remarks and observations as a whole about the character of the person. Now it's time to take each and every data, each and every phrase, in order to see if we can have information or if we have clues about about these options or some other options. Let's start of analyzing every data that we have. Woman. We know that women tend to develop different constitutional pictures than men. There are constitutional pictures that are more characteristic of women, and some that are more characteristic of men, and some that can be both found in men and women. There are some constitutional pictures that are more often to be found in children or in old people and so on. So we have woman, 39 years old, English teacher, married 5 years, no children. She is thin and has lost 5 kilos recently. The doctor didn't ask, why did you lose these kilos? Why did you lose weight? What happened? You should always bear in mind to ask, why? If your neighbor told you, I've lost 5 years in 1 month, wouldn't you ask him, why? What happened? You're a doctor. You don't ask these things. You should ask, why? I have pain when I have sex with my husband. Why? Is it a pathological problem? Is there something there in the vulva, in the vagina, that is pathological and causes pain to any woman? Or is it psychological? We have to ask. Why you didn't have pain during sex before you got married, and why do you have pain now that you have married? Why? It's so important to ask these things. You should ask it in a sensitive way, in a way that you don't block your patient. You shouldn't criticize. You should show human interest. Why so? What happened? We have a very good care of her appearance. Artificial nails, high heels, modern outfits, always well-combed, makeup 3, like a Barbie. Air of platinum, cool and friendly, to me more than expected. Exaggeration in her appearance, in her outfits. Exaggeration in the way she talks to the doctors, in the air she has. What about this leads us to a syphilitic person, or to a person that what would you think of such an appearance of a Barbie? Platinum. Anything else? Maybe palladium. Maybe lachesis if she was kitsch in her appearance. That is, with no sense of charmness. Systemic lupus, diagnosed 20 years ago, yet at the present or in the past, she doesn't have any generalized symptomatology. Have you seen many patients that suffer from lupus, systemic lupus, for 20 years and having no symptoms? Either we have a wrong diagnosis, or we have something that was cured, or the patient is exaggerating. They told her you have lupus systemic, and the last 20 years she says to all people, I have lupus systemic. It's peculiar, doesn't it? It's peculiar. Systemic lupus, 20 years without any symptoms. Tendonitis, back pain, dorsal pains at times for the last 10 years. It may be pathological, but it may be nervous or hysteric, as the whole history reveals, because when she got married, she had, and she didn't want to get married, or she didn't feel well, she had this hysteric cramp, let's say, of the muscle of the thigh, and she couldn't walk at all. Okay, so I am justified to say that perhaps these kind of pains are from muscular tension, are nervous or even hysteric ones. Dysmenorrhea, once again pain. Examinations didn't reveal endometriosis, that is, there is no possible pathological reason for this dysmenorrhea. Dyspareunia, only after her marriage, no problem with the same man before that. Something happened. Okay. Bellyache, distension abdomen, constipation, dizziness, roaring in the ears, nervous symptoms, or even hysteric ones. We have a person that has a lot of tension. Tension in the body means tension in the mind. It may be the tension of our argentum nitricum that has too many thoughts, quick thoughts, obsessions, and he has tension in the body. It may be an atrium muriaticum that is easily hurt, keeps all the bitterness inside, and then she has nervous headaches. It may be valeriana. I'm not talking about this case, I'm talking in general. How you should think. Okay? If it was valeriana, she is so, she doesn't know what she wants, she's so nervous and wanting this or that, she has so many inconsistencies, and this kind of mind problem goes to the body, and she sits and does this, or nervously has this with her hair, or this or that, and so on. So you can see that even from the pathology, even from the diseases and the symptoms that she has, as to her body, her physical symptoms of diseases, we can draw information And always, if it matches the whole picture. Okay? Code 3. A hysterical person, syphilitic person that is code 3. What comes in your mind? Mosch. Okay. But it has to be code 3. You see, if the doctor here was mistaken and said code 3 because she has in front of her a syphilitic, exaggerating person, are you cold? Yes, I'm very cold. Code 3. The doctor writes code 3. And if we do repertorizing and we are focused in isolated rubrics, then we are wrong. She may be code 1 or not even code. So we must not focus on isolated rubrics, only if they match at the whole picture. If I have the personality of Mosch and I have the information code 3, yes, it's important it's an important information for me, okay? Let's proceed to other data. Irritability 2. I am nervous or angry or weep. Nervous, angry, weep. When is she relaxed? Never. I am nervous or angry or weep. At times great anger and at times calm. When angry I break things. I break things. How much I break things? The patient says, I break things. And what does she mean? That 10 years ago, she had an argument, and she has thrown her mobile phone, and it has broken. Is this break things? No. It's misleading. It's incorrect. You put it on the repertory or on the expert system, and you are led to stramonium or to tuberculinum or to quina and so on. I always insist and tell the doctor who takes the case, you should evaluate each and every information. Break things 1, don't write it. Break things 2 or break things 3. It's so important. It doesn't say anything to me, or it may be misleading if you write down breaks things. So what? Did you ask how often she breaks things? It's not the same thing to throw a book that I know it doesn't break, or to throw a glass, or to break a china vase, okay? Or to kick the glass of the door and break it to pieces. It's a quite different thing. How often? When? In what occasions? It's so important. Quite often my anger comes from discussions with my mother. It could be a syphilitic case of lachesis, and most often, if you have a lachesis patient, and her mother is also lachesis, and she is old, and they live near or in the same house, then you have the Trojan War. who is going to have the upper hand? I know better, says the old Laches. You don't know. Yes, I know. You don't know. And so on. So often we have so many fightings between a Laches person and the Laches mother. A Laches woman and the Laches mother. Especially when the Laches daughter has come up to age of 40, 50 and has the upper hand, and her mother lives with her and depends on her. It's a kind of revenge. You did this and that when I was a child and you had the upper hand. Now I am going to have the upper hand. It's just a thought. I read this phrase and the thought came to me because I know the constitutional pictures. And this reminded me of Laches. I write it down and try to see if other data matches this observation. Syphilitic people tend to argue with their mother. If you are a psoric person and your mother is psoric, you don't argue with your mother. And if you are a psychotic person and your mother is psoric, you say to your mother, shut the fuck up, as a Bedorin would say, and that's it. You don't have quite often arguing, okay? Because you either ignore her or say shut up. But when you have quite often arguing, it's another case. It's mostly syphilitic cases. Tidiness, 2. The doctor evaluates tidiness as 2. I am tidy and organized in my life, both at job and at home if I can. Do you agree that it's tidiness 2? Or not?
She says if I can.
She says if I can. Well, all people, if they can, they are usually organized and so on. This if I can erases the previous. So I shouldn't say tidiness 2. I shouldn't write anything. Okay? When we prescribe, we don't do such analysis, so much this kind of analysis. I do it for training reasons to you in order to help you achieving the holistic way of thinking, the thinking that we do in the classical miasmatic constitutional homeopathy. Extrovert 2. I speak about my personal matters to 5 people. Well, let me tell you, from my experience from many students of mine that I have taught this kind of method, they don't make it clear to the patient that when we say personal matters, we mean personal matters. Only if the patient understands that we are talking about very personal and private matters, only then we have correct answers that aren't misleading. If you ask someone, it's so important how to ask. You ask someone, to how many people do you talk about your problems? It's a wrong question. You should say about your personal problems, about your truly personal matters. Only then you have an answer that you can evaluate correctly. I talked to 3 people. Oh, 3 people, yeah. Who are these 3 people? To my doctor, to my psychoanalyst, and to my priest. Thank you very much. Nothing. Everybody talks to these people, but that doesn't mean that he's an extrovert person. Fears. 3. I am afraid of disease, of being in pain, of not having enough money, of not having a job. Above all, I am afraid of not being happy with John. But my number 1 fear is the fear of being in pain. Something that I have realized that I didn't expect is that I am incredibly phobic, and this intensifies my physical symptoms, and my patience is lost. I am not calm, and my thoughts aren't clear. I don't want to be in pain. When I am in pain, I get distracted. When something happens to me, my pains last long. It's the long lasting of the pain that distracts me. Is this a person with fear 3 or not?
No.
Why?
Because she speaks about a lot of fears, but not for intense fear, for a particular fear. No.
Well, we have a person, that's why it's so important in order to evaluate any rubric, any phrase of the patient, the great tool that you have is the whole picture and the miasmatic aspect. We have an exaggerating person. We have a hysterical person. This person is not phobic 3. If I say this person is phobic 3, then I will go to aconitum, to arsenicum, to azotum nitricum, phosphorus, and so on. This is not a phobic 3 person. This is a hysterical person. Her number 1 fear, she says that to us, her number 1 fear is pain. And it's a hysterical pain, as we have seen in the whole case. So I shouldn't look and search for phobic constitutional, main phobic constitutional pictures. Above all, I am afraid of not being happy with John. Oh my God! Above all, I am afraid of not being happy with John. Are you happy? If you say such a phrase, it means that you are happy now. And you are afraid of not being happy. But she isn't happy. The last 5 years, at least, that she is married. And her body tells you that she is not happy, and her psychological state tells her that she is not happy. So she is lying. She puts forward something, a secondary behavior. So she is syphilitic. She has inconsistencies. For God's sake, if you were happy, you would enjoy sex with your husband, you would have liked to have 5 children,